All right, good morning. I think we'll get started. Appreciate you all joining us. We're joined here live today with Kurt Carlson from the Bowen Center. Good to see you, Kurt. We also have two members of the press from News Now 1480 and Ink Free. So glad to have you here. Good to see you. We are joined, as usual, by Dr. Remington from the Kosciuszko County Health Department and Teresa Reed from the Health Department as well. Mentioned Kurt from Bowen Center, and Jay Dale's here with us today from KCH. So I think we are all very happy to be continuing a little bit of a downward trend without getting too cocky about it, if you will. It's important to continue to do what we're doing. It's important to make sure we understand how important the vaccinations are and how safe they are, how streamlined our process in our community has become. We're very proud of what the health department has done on setting up the vaccination clinic. So the vaccinations, again, are available for those 65 and over at this point, and healthcare workers. I won't get into that. I'll let Dr. Remington and Teresa talk about that, but that seems to be a big point of focus now is we want to get through this, doing the right thing, not letting up on our precautions as far as our masking and everything else, and gathering and hand washing. You know, the same rules still apply, but with the vaccinations now becoming available here locally and very accessible at this point, as we await continuing increased access to those vaccinations. We feel like, at least from a government perspective, I know Commissioner Groening and I had a chance to talk a little bit before this, and that really is the focus, is to get folks vaccinated and get people continuing to work, back to school, and all of the things that we were doing a little over a year ago. So it's hard to believe it's been a year.
A whole year.
Well, Teresa, I'm going to ask you to jump in and give us our numbers, talk a little bit about where we stand on the state map and how things are going with the vaccinations and the schools and anything else you want to talk about. So, Teresa?
Okay. Well, the numbers have been going very well lately. It's really a relief to see how they've come down. In the last 3 weeks, if we average out the numbers, we've had 17 cases a day. And this week's looking even better than that. But since it's had a snow day, we're not going to look at that one yet. So that's going very well. That trend is also happening throughout the state. Recently, Indiana's seen several days where we were less than 1,000 cases, and positivity is now down to 5% for the state. So that's looking really good. So that's very upbeat for me. In Kosciuszko County, our vaccine clinic here at the health department has been going very smoothly. Not necessarily without pain for us, but it's very smooth, and we think we're giving a good service to the community here. There are vaccines available. We are not having a shortage at this point at all. We have plenty. There are appointments available this week for those who fit the qualifications. The state may be looking soon at changing those. We don't have any control over where the state's going to go, but we just follow them when they tell us that it's okay to serve the next group of people. So hopefully people have a good experience when they come in. It's moved very quickly. People don't need to come. There are not lines. We're able to serve you. If you come at your appointment time, we can get you in and out. There's no need to come early for your appointment. If you come early, a lot of times there's some space and we'll just push you through and get you through. But there's not lines. It's organized. You'll sit there after your appointment for your 15 minutes in a monitored environment. And but it's running smoothly. You don't have to stand in line and wait.
All right. Well, I'm sure there may be a few questions, Teresa, so thank you, and I'm sure we'll be back with you. Dr. Remington.
Well, thank you for asking the health department again to be represented at your meeting, Mayor. I really have nothing to add to what Teresa has already spoken in regards, but I have to show you her work in this graphic just to add some color to her presentation. You can see where we were over the last several months. Thanksgiving is about the middle of the mountain, and mid-September is just ahead of the mountain, and we're down the other side. Now, I wish I could be predictive as to what we're going to do in the months ahead yet, but I'm hoping this will be the biggest surge that we will experience with this pandemic, and it's been impressive. So I am so thankful we are at where we are today on the timeline with this graphic. Vaccine is a game changer, and just to highlight what Teresa said, get a vaccine, it's safe. We have some issues with allocation, so you have to wait your turn with the state age bracketing and inclusion groups. You can go online to ourshot.in.gov or use 211, which I just heard from a patient this morning is working much better. You're not on hold as long. And we have people in the community that can help you schedule your vaccine. It's a real game changer. Very safe vaccine. It does not alter your genetics forever. There's nothing hidden in the vaccine to impact your life forever. Very effective. We're very fortunate to have it. A century ago, with that terrible pandemic, they gave vaccines, but they were nonsensical. They did not even know what a virus was. We have a completely different experience today. They've been able to target vaccine therapy very effectively using very innovative techniques. So I hope that to our listeners that they would strongly consider immunization when it's their turn, and for perhaps their family members or loved ones that are already part of an inclusion group, encourage those family members and friends to be immunized. It's very easy to do. We have a great clinic, and others, including our hospital and pharmacies, are providing vaccine. We're going to be doing this for a while, so good news today. Thank you.
Dr. Remington, I know you'd mentioned the pharmacies, and I know that several of the pharmacies, I believe, are on the ourshot.in.gov. Are all the pharmacies listed on OurShot? Have they all gotten on that registration platform?
It just takes a little savvy with navigation. If you go to ourshot.in.gov, as I did yesterday morning, not all the pharmacies will pop up on the map for our county. But if you just click on any one of those sites, say our health department immunization clinic, and you self-attest that you are part of the inclusion groups, you will then be offered the opportunity to schedule. And at that point, your menu will open up, and you'll see that there are several options for you depending on the zip code that you enter. It's quite a lengthy list, so you have freedom to use any of those opportunities that pop up for you. Just have to navigate a little bit around that website. It's not terribly challenging to do that, but it may not pop up immediately when you look at that state map for vaccine sites. So we seem to have plenty of vaccine right now at the health department anyway. How that will look when the new grouping changes at the governor's declaration is anybody's guess. We've seen surges of interest in vaccine every time that's happened. So if you're in an inclusion group today, here's my advice: schedule now, because once they open it up again, you may find yourself struggling to get a prompt appointment. So.
And when you mention inclusion group, you're talking primarily at this point, besides the emergency workers, you're talking primarily a certain age bracket, correct?
That's correct. So healthcare workers, the 1A grouping, healthcare workers, first responders, And then it was age bracketing. That was the State Department of Health's directive, which I fully support. So we are at 65 and above. The next grouping is anticipated to be 60 and above. And maybe at that point, they will be including some people with pre-existing illnesses, which will depart a bit from the motif we've seen in the last month. So stay tuned. This will all hinge on typically a press briefing through the governor's press release on Wednesday afternoon.
So kind of to summarize, we've been able to handle those inclusion groups to this point. We've got plenty of vaccine at this point, but as you suggested earlier, we don't know when the next access will come and what age groups will be included. So we're, I think, trying to anticipate that, but at this point, I think your advice is very important, that if you're able to get a vaccine now, it makes good sense to do that. I certainly agree. I think the age group has been a good way to do it. Seems like in Indiana, we're doing very well getting the vaccine rolled out. You see lots of national reports of that not being the case. So especially here in our community, again, I think with the governor's protocols and the way Bob Weaver and Teresa Reed and you, Dr. Remington, and everyone over at the health department have done a marvelous job getting this shot clinic established, if you will, or I should say expanded. You've always had a good shot clinic, but now with the COVID vaccine, it's obviously a different ballgame. So we'll just kind of hang in and wait until we get the next age group opening up. So I will ask you one more question that I know I get asked a lot, and I see the discussion about the variants seem to be, not only are there a few, there seem to be more and more variants. My understanding from what I've seen is that at least at this point, most of the vaccines are effective against those variants, but there is discussion that they can spread quicker, and can you comment on that?
Sure. Well, you've said it all correctly. I mean, that's what happens with these respiratory viruses that have just a high rev genetic engine, if you will. They mutate quickly. Influenza does that. Coronavirus does that. The good thing is that vaccines for either group usually will help you tremendously, even if it may not perfectly fit the latest variant. And that's totally different than, of course, than a completely different genetic subset of the virus, which is seen in pandemics. So that's what we've been experiencing. So in the midst of the pandemic, you expect to see these subtle little variations develop. They'll each be unique. They'll each have clinical characteristics of their own. But so far, we've not seen anything that would suggest our current vaccine strategy will no longer work. It should work. So it's not shocking to see this. They aren't to be feared. They're to be respected. It adds one more question mark as to how this graph may look in the weeks and months ahead. It just adds another variable that's very hard to predict. So kudos to those scientists, the companies that have created these vaccines. They're great. Pursue them. And they have shown that they do work against the variants that are popping up now. Great question.
All right, thank you. Teresa, anything to add from your side before we move on, as far as the vaccinations or school numbers or anything else?
Well, luckily the schools are displaying much of the same decline as everywhere else in cases. And they know what they're doing with this now, know how. There's been new guidance from the state on what can constitute a close contact in a classroom setting, although those guidelines get somewhat difficult to carry out, and some of our school systems they're looking at how to do that and which guidelines to follow, how to follow them, how to follow the guidelines as they deal with their situations. But it's nice that right now things are going well. It's a great time to be learning something new.
And before I let you go, I know we discussed earlier a little bit about our dashboard numbers for the state, our advisory level, and I know they will post the weekly updates at, I believe, at noon, a little more than an hour from now. I assume from the way you're all talking, we'll certainly stay yellow. Can you give us a little update there, either of you?
That's true. We are. I had a little heads up yesterday, and I'll be confident we'll be yellow again. The advisory level will be yellow. So things have loosened up as compared to 6 weeks ago.
All right. Well, thank you all. All right. Kurt Carlson from Bowen Center is doing a great job with our testing, and now they've pivoted somewhat to our hotline. Kurt has joined us here in City Hall, and I'll turn it over to you.
Great, thank you, Mayor. The test site, so far we've done over 14,000 tests since we opened, but like nationwide, testing is down significantly. So now we're averaging about 250 tests per week. Again, that's persons who need the testing. We're doing that. And just recently, the governor issued a directive to schools that they need to be doing their own testing, and the state is supplying each school system a certain number of tests based on number of faculty and number of students. I reached out to all of the school systems in Kosciuszko County, and they were greatly relieved that we would be willing to do that testing on their behalf. And so Warsaw Schools, Wawasee, Tippy Valley, Whitco, Lakeland Christian, and Sacred Heart, when they receive the rapid tests from the state, then they will bring them to the test site, and they can refer any faculty member, student, family member of students or faculty that need to be tested. We will do the rapid test on them. We'll fill out the form with their name, the date, and whether the test was positive or negative, and they can then carry that immediately back to the school and let the school know what the results were. And we have had referrals already. It's been a trickle so far, but we'll see. Second thing I want to mention is the hotline. We've been operating that now, and the majority of persons calling in are elderly persons who have difficulty navigating with the computer or not having computer access. We also, because all of our staff there are bilingual, we also have the capacity to enroll Spanish-speaking persons because the state website is only in English, and if you're only a Spanish speaker, it's inaccessible. So we have enrolled some persons, we get them on the phone, and then we open up the computer and we take the data for them and enter it in. 80% approximately of the persons who've called in have wanted to get enrolled, and we've gotten them enrolled. The others just call for questions. They're still trying to decide. So we have developed a form, not a form, but a sort of a handout to encourage people, Spanish and English, to get vaccinated, and also frequently asked questions, which was developed by the Hispanic Coalition in English and Spanish, and we also have our logo on that. So we are distributing those to everybody who comes to the test site, but also Gamal has been out handing them out in schools, in businesses, in manufacturing plants, any restaurants, churches, any place that there might be Spanish speakers, and we want to encourage them to get vaccinated. And interestingly, I was just sharing with Dr. Remington that when I look at where people choose, because when we open up the website, it shows all the places in Kosciuszko County and other places if they want to go somewhere outside of the county. And of all the ones that are shown in Kosciuszko County, the vast majority, only a few, have not chosen the health department. So the health department has certainly maintained a very positive image in terms of their vaccination clinic. That's where I got my vaccination. Here, I think I got my second one about a week ago. And in fact, it was a week ago yesterday. And by the way, all I had was a mild headache, no fever, no other symptoms. Other people respond differently. But for instance, Bowen Center, of our 1,500 staff, so far 33% of them have either gotten their first shot or completed both shots. So they're well on our way, and our goal is to get to 80%, which is what the population needs to be nationwide, actually, to have that herd immunity, which gives that extra protection to all of us going forward. I think that's pretty much the data, Mayor.
All right, thank you. I certainly appreciate all the work you're doing. It's been important, and I guess it's good to know the testing numbers are coming down, but now we really try and pivot to get everyone the ability to access and register for the shots. And I can't emphasize that enough, that, you know, we're kind of in a lull here before the next age group gets opened up, and we certainly need all healthcare workers and anybody 65 plus to get in and get the shot. And I know you guys are doing a great job with the hotline, assisting those that are challenged with technology. I might have even called had it been available, but I was able to get on it. It's pretty simple to get on and navigate that. So, but that's certainly a big help, and the bilingual capability is even more critical. So, thank you for that. Jay Dale is joining us from KCH. I know Jay is providing some vaccinations, and I'd ask Jay to talk a little bit about that, and then some of the precautions the hospital has instituted from day one, and maybe giving us some update on that. So Jay, good morning, and thanks for joining us.
Good morning, everyone. Glad to be here, and glad to see the numbers dropping. As Dr. Remington mentioned, got our fingers crossed that this will continue as a trend, although we can't predict the future at this point, and don't understand necessarily what's driving it. But obviously there are fewer people testing positive, fewer people that are contracting COVID-19. And we're seeing the same thing here at the hospital. It's very, very reflective of the overall numbers. We only have a couple of patients in-house, and they're not in the ICU, which means that the severity is lower, which is great. We are still providing testing here at our urgent cares, in our respiratory clinic, and of course at the hospital lab and ER. And we also have vaccines available, as you mentioned, Mayor. We are providing vaccines Monday, Tuesday, and Wednesday from 9 to 2 p.m. And we're focusing on first responders and healthcare workers, the 1A classification, but others can also sign up if needed. We do have excess capacity at this point. We're probably about 70-75% of the availability is being used up right now. We're still providing monoclonal therapy for patients that are at risk, that may have early symptoms from COVID, and we're doing about 7 to 10 patients a week right now in the ER and in our outpatient clinic here at the hospital. We still have those available for the community should they need it. Good news, our visiting hours have really opened up from 8 a.m. to 8 p.m. now, so 12 hours a day. You can have, if you're a patient, you can have one visitor, and that's in any setting, inpatient, outpatient, including the clinics, including our urgent care, including our imaging center, and so on. So, you know, all of the locations allow for one visitor, and there can be multiple visitors, but only one visitor at a time, if that makes sense. Now, if you have a child, you can certainly, both parents or guardians can attend with the child, of course, and that's again in all locations. Starting in March, we're going to roll our volunteers back in, those that have completed their 2 vaccines, 2 shots, will come back in, and they're very happy about that. They've been asking for a while when they can come back in. We feel comfortable enough to provide that opportunity, and we are certainly happy that our volunteers want to come back and help, because they provide a tremendous service. So thank them for that and for being available for us. I think the only other thing that I want to mention is encouraging people in the community that have had COVID to please come back and see your doctor, your primary care provider. There is a syndrome called the long haul COVID syndrome that is becoming more and more prevalent. It's funny, when I saw long haul, it's funny because, my stepdad was a long haul trucker. And so that's the first thing that comes to my mind, not long haul COVID. But anyhow, this long haul COVID has a lot of long lasting symptoms that could be attached to COVID, and our primary care providers are, aware of this and are, of course, ready, willing, and able to address those concerns so they don't become more of an issue in your life. So I would just really promote that for patients and those that have had COVID and perhaps were not hospitalized but had some symptoms, to go ahead and see your primary care doctor for a checkup. We are seeing a resurgence of patients coming back to the hospital setting in different departments, diagnostic departments, testing departments, cardiac patients. Referrals and activity has increased pretty significantly. Oncology, unfortunately, has also grown, but it's sort of getting back to normal, if that makes sense, versus it was suppressed somewhat over the last 9 months or so, while I think people were concerned about coming to testing centers and so on. But people are coming back, and we are helping to address those concerns, and certainly will be there for all of those battles with our patients. But again, just sort of encouraging folks to get in and see their doctor and get the preventive screenings done if you can. I think that'd be good for you. So that's about all I have, Mayor.
All right.
Any questions?
No, thank you. I sure appreciate it. So let's go to questions. I know we're joined again by 2 members of the press here, so I'll open it up. If you've got a question, just grab the microphone. And
Hi, this is Leah Sander with Ink Free News. My first question is, this might be making an assumption about some people's ages, but I know Mr. Carlson said he had received both his vaccinations, and I believe Dr. Remington has. Has everybody on this panel been vaccinated so far, or some? I don't know if some people haven't qualified yet. So. Yes,
I have. I've got my second shot. As a licensed healthcare professional, I was offered early on in December, so. Yeah. Kurt, I'm not going to ask you your age, so.
Well, no, it's because of being in the healthcare arena.
Yeah.
So.
Yeah. Jay and Dr. Remington and Teresa, have you all been vaccinated?
We have it. As a healthcare worker.
Okay.
Yeah.
Well, in my job, actually, I don't interact with the public routinely, and I also had COVID in December, so I've deferred my vaccine. Since there's still shortages, there's no reason for me to take it right now while I still have natural immunity.
Okay.
All right.
Another question is, this would be for Dr. Remington or Teresa Reed. Have you seen any cases of any of the variants in Kosciuszko County yet of COVID?
There's been no information back from state of any variants that I know of, and I probably would hear something about that. Dr. Remington might be the first to hear it, but I might hear it through the electronic means I have.
Correct. The state has seen some, but as far as I know, nothing in the county.
Yeah, I think I saw this morning that Quest, isn't that still the lab for the state I'd heard the government is having Quest do extra testing to determine if those variants are present. Any comment on that, or?
I may not be able to comment as to Quest's involvement, but I have seen webcasts from the State Department of Health speaking to the fact that their own state lab, which has a really finesse work with virology, is doing routine sampling for the variants, and if there is concern on their early testing, samples are sent off to the CDC. So they have a process where they are doing active surveillance for emergence of the variants in the state of Indiana.
Okay. Nick? Nope.
You already asked my question earlier.
All right.
I'm good.
I guess I have one more question, and this is, I'm not sure if this is for Dr. Remington or who it's for, but I was just wondering if there's probably no way to gauge the public in Kosciuszko County how many are actually averse to receiving the vaccine. I mean, do you have any, I mean, there's no way to track like how many people have no desire to get the vaccine even if they qualify or not. Do you keep any records of that? Or I was just curious as, and I was just wondering, of the people that qualify, has there been an age group or demographic that's been more receptive to receiving it than the others?
I do not know for our county statistically, formally, as to the percentage of patients unwilling to be immunized. I have heard thrown around in national discussions a 50% acceptance rate. I don't know how valid that number is, quite frankly, and I don't know whether it is germane to Kosciuszko County. What I can attest to is our anecdotal experience at the health department. Of course, we have a selection bias, of course, but there's been exuberance with and elation with people being immunized. As a private physician, I have hit and miss types of discussions with my individual patients regarding their warmth to receiving the COVID vaccine. I would say in my small slice of the world in my private practice, I'm averaging better than 50% interest in the vaccine, but that's very informal. We'd love to know. That would help with planning as we think of rolling out vaccine allocation in the next 6 months, perhaps. It'd be helpful to kind of know how much take there would be on the vaccine. Of course, we are already engaged in discussions at the community level in ways to try to promote increasing acceptance of the vaccination message for COVID.
And maybe
It's
I
a hot
can.
topic, great topic.
Yeah, and maybe I can mention, I have a number of Hispanic staff, and there is culturally some resistance to vaccinations. And we're trying by having flyers, brochures, frequently asked questions in both Spanish and English, and trying to get those as widely distributed to persons in their workplace or the restaurants or places of worship, to encourage them. And so that may be a population that needs some additional encouragement.
I think anecdotally, I've heard, as Dr. Remington mentioned, initially 50-50. It seems like that's going up a bit since this whole process started. I did talk to an individual the other day that represented a large organization, and they had surveyed their organization, and there was 75% acceptance, and he was concerned about that. And I said, I think that's fabulous. From what I'm hearing, 75% seems to be maybe on the high end. Just anecdotally, I think we're somewhat north of 50 and somewhat south of 75. But it does seem that as more and more are getting it, I think Dr. Remington mentioned the exuberance of the higher age groups, the more at-risk populations. I think socially they felt so isolated. They're just so happy to get something that's going to offer them hopefully an end to this crazy thing. And I think that exuberance hopefully is spilling over to their families, and their families understand that if it makes mom and dad happy, I think it should hopefully be something we should do and get this thing done. So I've mentioned before, I'm always the optimist, but I feel that we're hopefully, just with the rollout and the lack of real problems, especially locally, the ease of this. Everyone I talk to says they go out to our health department clinic, and it's like clockwork. It's done before they know it. Sit for 15 minutes, they're done. They've already been pre-appointed their next shot. And again, I would just emphasize how critical it is now that there's really some availability and some appointment times, maybe only 3 to 5 days out. It'd be a great time for those that are still eligible, currently eligible, to have that done. But I think, we've spent some time with our employees educating them. There's some good education out there. We've actually required our employees to be educated on the vaccine. We have not required the vaccine, but it seems like a lot of folks that I've talked to about what we've done here have tried to emulate that and have gone out and found appropriate materials for their employees to at least educate them and try and demystify some of the pseudoscience that seems to be passed around. It's a good question, and we've got a local group getting together Friday to talk about vaccinations in our county, and I know just the education and trying to demystify the vaccination and really encourage those to get it is probably going to be the focus of our conversation. So I think that's, to me, focus one. That we get shots in arms so that we can, get back to supporting our small businesses, allowing our small businesses to open up further. I've said this before. I've been on a few meetings, and our small businesses can't take another year of this. We've got to get everyone to understand how critical this is to try and knock this thing down. Now we have something we can all do, and if we do it, I'm very optimistic. We'll be hopefully maybe late summer. We'll be ready to kind of open back up. But again, we'll see how that goes.
Well, maybe, Mayor, maybe I can add for the Bowen Center, we have a lot of nurses, and our infection control nurse and our director of nursing a couple times a week have a call in, Ask the Nurse. And that's been very popular and really has helped people feel more comfortable getting the vaccinations. So I think that's how, so far with Bowen Center, we've got to about 33%, because people could overcome their resistance by having a trusted person who can give them a factual answer and the encouragement. So I don't know how we could replicate that on a broader scale, but that's something that's been very popular with our staff.
Well, I know, Teresa, you've been taking a lot of calls at the health department, and I'm sure you spend a lot of your time educating folks on the vaccine. But Kurt, you're right. I think it's something we need to continue to focus on as a community, to encourage and get folks to understand how really this is, as the governor said, it's our shot, it's our time to make a difference. So, any parting comments, Dr. Bill?
I think promoting vaccination is our biggest job right now. It's a real game changer. And the quicker we can broadly be immunized as a population, the quicker this gets in the rearview mirror. So do it for your friends, do it for your business friends, right? So we don't want another year of this, for sure.
Teresa, any final comments from your side?
I'm just feeling hopeful right now and taking it one day at a time, and hope we all just stay safe through this weather too.
Great. Jay, any comments, hospital, before we sign off here?
No, just reminders to, go see your primary care doctor and make sure that you address issues before they become a big issue. Just a side note to add on to vaccine numbers, we're just under 50% for our healthcare workers. We expect that, we'll get close to probably 70% within the next month or so, based on the numbers that we're seeing right now. So it's moving in the right direction.
Great, thank you. Kurt, final word.
Seeing Jay on the screen and remember him speaking about the long-haul COVID syndrome. So that's for people who've had COVID. And some people say, well, I can handle anything and then I'll get over it. But I think what he was sort of communicating to us, there can be some long-term chronic health conditions that are a direct result of having COVID. And so it's not like the cold or a flu, you have it, it's done, that's it. It seems like for some persons, not necessarily everybody, well, maybe it will be everybody, we don't know. But the long-haul COVID syndrome talks about that, the respiratory and the heart, and now I'm also hearing some brain syndromes. So having the vaccine so that you can prevent getting COVID may be a long-term health benefit to you to prevent having some of these long-term disease. And I don't know, Jay, if that accurately captures what you were communicating.
Mm-hmm. Yes, thank you for that clarification. I think that the vaccine will either mitigate or minimize or at least reduce the symptoms and the potential long-term effects that COVID could have. So if you're looking at two options, having COVID or the vaccine, you're definitely better off getting the vaccine.
All right, great. Well, thank you. Thanks, Teresa and Dr. Remington. Sure appreciate it. Thanks, Jay. Kurt, always appreciate everything you're all doing. Again, just the reminder, the vaccination, let's do it. Got to be just as direct as we can that how critical this is, how important it is. Again, I look at it as our chance to get open back up and to give our businesses the ability to open back up to the way they were and kind of get back on track. I think that's a huge part of this. So we will meet again in 2 weeks. I think the importance here will be to continue to update on vaccination opportunities, vaccination education, and any hopefully continued decline in our health statistics. So thank you all for joining us, and we'll see you in 2 weeks. Take care.
Thank you.
Thank you.
Sorry, Mayor Fowler, I forgot you were an eye doctor. I was almost asking that question. I realize healthcare workers obviously get it too, but then it's almost like you're age shaming someone, and then someone could be like, well, I'm not 65.
Well, actually, I'm 65 as well, so,
Yeah.
but that, I jumped at it when it was time. It was,
yeah.
and I didn't want to make a big deal of it. I just think, I think the schools are a little wanting to kind of jump in line now, and I understand their anxiety. I feel like people are kind of getting it on the vaccine, but, there's all that political overtones that people tend to continue to hang on to, and I'm just certainly hopeful that it's.
Well, Mayor, one of the things I communicate, I actually sent an email to Dr. Weaver at the health department, she's overseeing all this, recommend